Hi everyone, my name is Maline Devi. My partner Nesalata and I will be talking about dengue. I personally wanted to talk about dengue to create an awareness, to increase my knowledge and the public's knowledge, and to improve our response towards the issue, as every year the number of dengue cases are increasing despite all the efforts that has been taken to prevent and reduce the number of cases. Even with the current pandemic, the number of dengue cases are still rising. Dengue fever is a mosquito-borne viral infection that has spread quickly through all WHO regions in recent years. Female mosquitoes, mostly Aedes aegypti and to a lesser degree Aedes albopictus, transmit dengue virus.
We obtained our case study from research paper.
Our case study is about a 32-year-old married man with no previous comorbidities presented to the emergency room with high-grade fever for 8 days, bilateral subconjunctival hemorrhage and swelling of hands and lips for 3 days, as well as one episode of nasal bleed 1 day prior. He also experienced tingling in both lower limbs and had trouble walking. He denied any previous bleeding or vomiting from other areas of his body. He denied having been in the hospital before, as well as any drug usage or substance abuse, and also denied family history of chronic illness.
There are few limitations that must be noted, and the first one is unavailability of vaccines to immunize the public against Aedes, which makes it hard to prevent the occurrence of disease caused by them.
Second limitation is that there is very less cooperation from the public, in which people are not supporting the government's initiative by keeping their environment clean, which is important to not create a place for the Aedes to breed and grow. The last limitation is the existence of abandoned housing projects, vacant lots and cemeteries in urban areas all lead to potential breeding sites, making it difficult for health workers to combat the epidemic.
Hello everyone, I am Nesalata and today I am going to provide a few recommendations in preventing dengue. I chose this topic because to disseminate information about dengue to the public and to encourage positive change in the behavior of the public towards the dengue threat. In view of the current COVID-19 pandemic, it is impossible for us to carry out mass campaigns. However, we can switch to doing webinars, online campaigns and virtual runs to increase the public's knowledge about the dengue threat. We can also get people to become creative by practicing the 3 R's, which are reuse, reduce and recycle, to eradicate Aedes breeding grounds such as old tires. It is also shown in the case study that intestinal mucosa injury also worsened the dengue fever in the patient. Therefore, taking probiotics may help to reduce the severity of dengue fever. However, always consult your doctor before taking any supplement. We can also choose to live an active lifestyle by exercising regularly to ramp up our immune system so that we can better fight against the dengue virus infection. Strict law enforcement is absolutely necessary, for example, enforcing the Destruction of Disease-Bearing Insects Act 1975. The conclusion? It is important for the public to keep their surroundings clean so that Aedes mosquitoes will never have a chance to breed. The government, individuals and communities together play an important role to curb dengue in our nation. 3 future studies can be done to study dengue in detail. First of all, lifelong immunity from post-dengue infection. Secondly, the gut microbiome and dengue infection. Lastly, the application of machine learning model to prevent future dengue fever outbreaks. Thank you for watching.